If we think about the 5-year survival for lung cancer in the UK, we know that lung cancer is the leading cause of cancer death. If we wind the clock back to about 2005, back then the 5-year survival from lung cancer was around about 6%. And over the next 10 years or so, through huge amounts of work from healthcare professionals and through awareness programs and that sort of thing, we managed to get the 5-year survival rate up from about 6% to around about 14-15%. And in 2016, the UK Lung Cancer Coalition wrote a report called 25 by 25. And that was a series of recommendations around an ambition to raise the 5-year survival for lung cancer to 25% by the end of 2025. And in fact, we were doing very well. And if we go back again to just before the pandemic, looking at 2019, we know that there's an estimate that at that time, the 5-year survival had come up to about 17.5%. So we believe we were on track to try and achieve 25 by 25. Unfortunately, because of many of the things I've just said about the effect that COVID's had on the pandemic, we have seen a significant drop in the 5-year survival. And it's estimated that we've probably dropped by about 5 percentage points. So probably down to around about 12 to 13% for people diagnosed during the pandemic. And therefore, we have written this report, and the UKLCC has come up with a series of recommendations about how we can potentially get back on track. So we need to get back to where we were before the pandemic. But not just that, we then need to push forward hard to achieve our ambition of 25% 5-year survival by the end of 2025.